If the 2018 midterms are any indication, health care should be a key issue for both parties in the new year. According to CBS News exit polling from last Tuesday's election, voters ranked health care as the top issue facing the country. And on Wednesday, Senate Minority Leader Chuck Schumer blamed Republicans for the state of the health care system.
The Republican assault on the health care system continues. They continue to pursue their destructive lawsuit to eliminate protections for pre-existing conditions. Costs are made higher and higher. Coverage gets diminished every day because of Republican sabotage. Prescription drugs are out of reach for too many, and the GOP knives are still out for Social Security, Medicare, and Medicaid.
Jane Tribble is a senior correspondent for Kaiser Health News. She joins me now from Washington. Sarah, thanks for joining us. According to CBS News exit polls from midterms, 69% of Americans say the healthcare system needs major changes. What types of proposals can we expect to see in the next year?
Well, so I think this is going to be interesting to watch, but at the same time, I think we should temper our expectations because we still have a divided Capitol Hill, right? The Senate is Republican and the House has tipped towards the Democrats. A lot of the moderate Republicans are gone in the House, so it's going to be kind of a waiting game. Now, right off the bat, the Republicans came out and President Trump came out after the midterms and said that drug pricing was a top issue for them. They're listening to their constituents. And Mitch McConnell on the Senate side, he said that drug pricing would likely be on the agenda. The Democrats have come out, including Nancy Pelosi, who is still expected to be in charge of the House. She has come out and said that the Democrats have a plan. And part of that plan is to call for negotiation in Medicare pricing.
Well, on the campaign trail, candidates on both sides of the aisle discussed protecting those with pre-existing conditions. And our exit polls found more than half believe Democrats will be better at that than Republicans. So are Republicans on the Hill working to change that perception?
Well, I think that it's going to be interesting to see if they come to agreement on such a big kind of policy shift coming out of the Affordable Care Act. I mean, a lot of talk about the Affordable Care Act in the past few years, a lot of attempted action. But as far as the pre-existing conditions go, if they're still divided like this, I think it will be touchy to see if they can actually get rid of that.
Well, 3 states, Idaho, Nebraska, and Utah, voted for Medicaid expansion last week. That brings the total number of states that have adopted it to 37, according to Kaiser Health. Is this a sign that Medicaid is still quite popular despite the rhetoric we hear around it?
Yes, I believe it is. These states that passed it, Idaho, Utah, Nebraska, these are deep red states. And the fact that they passed them is a signal that across the country, people are realizing that Medicaid is a program that's here to stay. The Medicaid expansion is a program that's here to stay. This was the biggest wave of expansion for the Medicaid expansion program since the Affordable Care Act passed. So I think that we can look ahead and expect more states. A couple more states to pass this. As you probably are aware, Maine had passed this. The voters had said they wanted Medicaid expansion in 2017. The governor there has fought that to a T, and now that we've got a shift there, we're going to see Maine is likely to expand. We can look at Kansas as well as Wisconsin, places where voters have said they're interested in Medicaid expansion. I know that the newly elected governor of Kansas, Kelly, has said that she wants to put Medicaid expansion in on day one. She's seen her state struggle with hospital closures in rural areas. Those hospitals have come out and said Medicaid reimbursement has been an issue for them.
Yeah, it's really proving to be increasingly popular, given the landscape out there. Jane Tribble, thank you so much, Sarah.
Thank you.